Now, nurses and other hospital staff in Sioux Falls say they are being stretched thin and becoming increasingly frustrated with the rising number of COVID-19 cases. Today, they put out a plea for the public to wear a mask, avoid large gatherings, and practice social distancing to try and flatten the curve. Traffic was backed up on Minnesota Avenue today at this drive-through COVID-19 testing site. The line of cars also circled around inside the parking lot. Hospitalizations are on the rise. Avera has even had to double up COVID-19 patients in some ICU units. Both Avera and Sanford say their staff are becoming increasingly stressed.
They're tired, they're weary. The phrase I heard was bone weary. I think we're bone weary.
They're working extra shifts, they're getting called in, they're trying to prioritize your care.
And they're becoming frustrated.
There's this horrible disconnect between what they see when they walk through the halls of the hospital, when they take care of these patients, when they hold a patient's hand as their last heartbeat occurs, or as their last breath occurs. And then they go out into the community and they watch people gathering in masses of 100, 200 people not wearing their masks, not seeming to understand that this is real, folks. People are dying from this.
That's why Sioux Falls Mayor Paul Tenhaken continues to support wearing a mask, but remains adamant about not having a mask mandate. He says it's unenforceable and isn't the solution, pointing to a map showing active cases around Sioux Falls.
A mask mandate would only be citywide in the city of Sioux Falls. And really, where the problem is everywhere, all right? And so a mask mandate in one municipality is a tough thing to say it's going to be a huge needle mover across the region, especially at the expense of the challenges that mandate would bring.
The mayor says he's equally frustrated with those who choose not to wear a mask while in public.
I, as a mayor, can only do so much to try and control the behavior of 200,000 people. And in this case, 500,000 people. I am one mayor of 80 frickin' square miles. Okay? Trying to control the behavior of an entire tri-state area. And quite honestly, I'm done.
Both hospitals say adding to their stress is the fluctuating numbers of staff who have either contracted the virus or are close contacts.